And I will confess, Florence Nightingale was my heroine when I was 8 years old. I grew up just reading and reading about her. Thank you very much for that. I think that's for Florence.
That's my husband, very privileged to be supported by such a wonderful man.
Our next speaker is Paola Conti, and she will speak on engendering health, a strategic challenge for global health. She's a health sociologist and facilitates education, engenders mainstreaming, and public policies innovation by collaborating with public bodies, with companies, universities, and research centers. Middle East and Africa represents the synthesis of practices and methods from traditional medicine, scientific findings, and her commitment in public policies. And Paola, please give her a hand.
Thank you really to invite me here. In my life, so many times I try to imagine the old library, and I can't believe now to be here. So, engendering health, I start from this point to share with you some experience, to reflect together on some point that for me are my way, the way I found it in my life, to traduce gender in practice. Because my job, I need to find methodologies, ways to traduce public policies or intervention in something very practical for people, for citizens. So I start to present briefly association ENGEA, Engendering Health, that is a non-profit association, and we are partner of the European Institute of Women Health. And we engendering like promotion of health, and also a way to integrate gender in the vision, in the complex vision of health. And then we also designed and launched a web magazine to introduce health professionals to the engendering health complex system. So I think that, on my understanding, what is most important in this moment is to find a way to make the research transdisciplinarity in research, to transform research that is now based on different disciplines in a very new approach, creating competence and knowledge through the filter of gender, I think. So, what is really a challenge is to transform transdisciplinarity from a model to a practice, to be able to use intersectionality to produce a new kind of knowledge and transfer it to, how to say, we talk about it a lot on these days. So self-reflection and self-awareness is something that have to stay in research. Is not something else from the researcher. And gender analysis and assessment and also values efficacy and equity. So intersectionality is to describe the universe of connection and also the uniqueness of each person. I go directly to a new field of research that is named gender medicine. I've been in the panel of experts on the International Congress and also in a European project about gender medicine. But what we are discussing about now, if gender medicine is really a new discipline, I think no, it's not. Because the risk when we talk about gender is that we create some new bodies, some new kind of power. For example, who is really interested now in gender medicine? Pharmaceutical companies. Is a big business, very big business, because till now the adverse effect on women, for example, because the studies were only on a medium man of 70 kilos, were not studied on women. So we have a lot of iatrogenal effect on women, not enough studied. But the new business is just a business. And I think we can go ahead and try to say what could be a gender medicine really, is to integrate the vision of gender into all the disciplines. And how to do this? You see, that men are studying with me about gender, how to integrate gender in health and safety at work, for example. I think that men could be involved in a right way, because I discovered that usually nobody talk with them about their own specific condition of men. And when somebody suggests that they can reflect on that, sometimes they don't agree, but when they agreed to reflect on themselves, then they are able to participate in very deep way and in enthusiastic way. This is my experience. To try, because we cannot engender health or medicine or something else without also specific point of view on masculinity. In Italy, we have a male association that in the last 20 years reflect on the specifics on masculinities. So the president is a philosopher, talk about the silence of male bodies, and he is very convincing to explain that this kind of silence is the big problem that not allowed many of them to participate in self-reflection, and without self-reflection there is no chance to talk about gender policies. So I want to talk a little bit about health and gender like a dynamic process. Both are dynamic process. Our process are not pictures. And then jumping through the dynamic concept, this is my vision about the two genders. Mostly in my field, when we talk about statistics, we sometimes describe men and women like two separated universes. And then to understand that we have on one side not only two sex, but we have really a biological, a human continuum. On the other side, talking about the social point of view about gender. Gender is a concept that really, to me, could be represented by the Taiji, is the best way to represent it. And also for health and disease is the same. And again, the vision is about a connection, a network. So I founded this research published in 2015 is names women supporting patients, men curing cancer, gender-related variation among Israeli Arab practitioners of traditional medicine in their treatment of patients with cancer. This could be the bridge to go to the traditional medicine strategy of World Health Organization. In this point of view, traditional medicine are a treasure of humanity. Is really a living treasure, a living tradition. So this strategic plan invite all the countries to integrate in their health system traditional medicine. My life gave me the opportunity to study and to grow up for 15 years with the Master Uli John, that is son of daughter of Master Uli John, was a very famous doctor and Qigong master, killed during the revolution in China. And I learned traditional Chinese medicine like a deep, intimate process that you cannot learn without being involved yourself, your spirituality, your deep knowledge of yourself, your body, your relationship with the universe. So she was used to tell us what the father told her. I don't teach you shapes, but how you have to work on your heart, because the heart is your taiji, is your one, is what allows us to connect with this emptiness. You can pull out from inside you the forms of taiji, and your system will change according to the time, space, and the season. You must also learn to absorb the experience of previous generation. And what is interesting also to me is the way I learn from her. You know, not all the secret pattern of the tradition are the teacher, the master are used to transfer to people mostly if they are foreigners. So the matrilinear teaching I received was also a very deep understanding to me, because was wide, totally based on your capacity to create your own method. She was used to tell me, need find your method. Find your method means put your life, enter with all your life in the method. The method are you, the method of teaching, the method of working. I use with a lot of people her method of Qigong. And for example, I discovered that how we describe in our scientific tradition many practices I learned, like spontaneous Qigong, that is a pattern to enter in repairing model of immunitary system. And there are a lot of studies now, studies and research about the effect of Qigong in cardiac rehabilitation and so on. And in Qigong traditional medicine, men and women are treated like men and women, not some neutral that doesn't exist. So to come back, not to come back, but to integrate traditional medicine and in our health system could be a big effort on one side, but a big result on the other side, because we don't need to create another discipline like gender medicine in the new concept. I jump on another experience. This is a small project we are dealing in Italy, in a small town, talking about the health community and well-being community. So talking about engendering health, I think also to put together people to let the communities be more resilient, more founded on trust, could be really an opportunity for global health. I know it's nothing new for you, I know. But on the other side, is like a revolution in that place where people are used to stay completely divided, separated one from the other. So there are many women from Maghreb, for example, in this town, and we are working to exchange experience, talents, competences. The rules is that everybody have to give something and receive something, and also this is as something healthy for the community, that there is not Italian or American or something else doing something for somebody, but that we are on the same level exchanging what we are, not what we have. So coming back to the well-being. So I finish now. What I and my colleague with me, I discussed with them before coming here. What we think is really important now is to democratize knowledge, describe what is a gendered study, what is not, because you can believe me, but for sure you can say the same. Mostly of scientific studies that as on the title as gender are totally not about gender. They are at least talk about sex, the two sex, but they absolutely are not appropriate like methodology to talk about gender studies. So we need also to use in a new way the new media inside the scientific communities, and we have to, how to say in English, popular science in Italiano is divulgare, to transform the information for everybody, and then integrating gender and traditional medicine. Thank you very much.